आज अभी जो है हम ओबीजी एंड गायनी के कुछ इम्पोर्टेंट पॉइंट्स जो है वो डिस्कस करने वाले हैं। सो ओबीजी गायनी स्टडी करने से पहले सभी स्टूडेंट्स को जो है फीमेल रिप्रोडक्टिव सिस्टम का जो एक कंप्लीट एनाटमी है वो क्लियर होनी चाहिए, तभी आप ये जो इम्पोर्टेंट पॉइंट्स हैं वो अंडरस्टैंड कर सकते हैं और समझ सकते हैं। सभी क्लासेस जो हैं फीमेल रिगार्डिंग फीमेल रिप्रोडक्टिव सिस्टम वो सभी अपलोड हो चुके हैं। आप जाके चैनल प्रोबेनसी क्लासेस को सब्सक्राइब करके उसमें सभी वीडियोस जो है वॉच कर सकते हैं। चलिए अभी जो है हम ओनली गोल्डन इंपॉर्टेंट पॉइंट्स जो है वो डिस्कस करने वाले हैं। सो the first point is there are the four openings in the vestibules. Vestibules में जो है four openings जो है वो होती हैं। Number one is urethral, then vaginal orifice, hymen, opening of Bartholin duct, and skin's gland. Fallopian tube is divided into जो हमारा fallopian tube होता है वो mainly four parts में divide होता है, that is interstitial, isthmus, ampulla, and infundibulum. Then the term parturition refers to the process of giving birth to a child including both labor and delivery. A parturient is a woman who is in labor. Full mature ovum is the largest cell in the body and is about 130 micron in diameter. Then release of oocytes or ovum भी हम कहते हैं from the ovary following rupture of mature Graafian follicle and available for conception is known as the ovulation. Then fertilization is the process of fusion of spermatozoa with the mature ovum. Then implantation of fertilized ovum occurred through four stages. ठीक है, जब इम्प्लांटेशन होता है फर्टिलाइज्ड ओवम का तो चार स्टेजेस जो है उसमें प्ले करती हैं, रोल प्ले करती हैं। कौन कौन सी? एपोजिशन, एडहेशन, पेनिट्रेशन एंड इन्वेजन। अलग से क्लासेस की जो है वो कंप्लीट होगी, सो subscribe the channel. Then the decidua is the endometrial layer of the pregnant uterus. Daily urine output of fetus at term is 400 to 1200 ml. The green color of amniotic fluid indicate the presence of meconium. जब भी ग्रीन कलर का जो है एमनियोटिक फ्लूइड दिखता है, इट मींस म्यूकोनियम जो है उसमें हुआ है। Then amniotic fluid appear golden color in case of RH incompatibility. It means RH incompatibility is the reason for golden color amniotic fluid. अगर डार्क ब्राउन का होगा कलर, इट मींस इंट्रायूट्राइन डेथ जो है वो बेबी की होगी। Then embryonic period begins at 3rd weeks up to 8 weeks post conception. The fetus is viable if born after 28 weeks of gestation. At term, the weight of fetus vary from 2.5 kgs to 3.5 kg in India. Hematopoiesis begins first in yolk sac by the 14th day of conception. At term, 75 to 80% of total hemoglobin is fetal height. At term, fetal immunoglobulin G level is 10% higher than mother. The maternal immunoglobulin G crosses the placenta from 12th week of pregnancy onwards जो है वो क्रॉस कर जाता है. The umbilical vein carries the oxygen blood from placenta to fetus. ओके, अम्बिलिकल वेन्स क्या करती हैं, कैरीज ऑक्सीजनेटेड ब्लड जो है वो फीटल लाइफ में बेबी को लेके जाती हैं फ्रॉम द प्लेसेंटा. अर्जुन @अर्जुन किंग, जय श्री राम. अंकित यादव जी, हेलो. I welcome you all in the channel. Subscribe the channel. Okay, then next point is functional closure of foramen ovale occurs soon after birth, but anatomical closure take place in about 1 year. ठीक है, जो फोरामेन ओवेल होता है डायरेक्टली उसमें जब फीटल लाइफ में तो वो प्रेजेंट होता है, लेकिन जैसे बेबी का बर्थ होता है तो वो क्लोज हो जाता है. बट कंप्लीटली क्लोज होने में, एनाटॉमिकली क्लोज होने में वो 1 साल का समय लेता है. The weight of uterus at term is 900 to 1000 gram. Then the weight of uterus in non-pregnant state is 60 gram only. Dextrorotation is rotation of uterus on its long axis to the right. Irregular, spasmodic, and painless contraction without dilatation of the cervix is known as the Braxton-Hicks contraction. Without, अगर dilatation नहीं हो रही है, then irregular हैं, spasmodic हैं और painless contraction है. Braxton-Hicks contraction is not felt in abdominal pregnancy में ये feel नहीं होती हैं. Then secretion can be squeezed out of breast at 12 weeks. Chlasma gravidum or melasma is pigmentation around the cheeks, forehead and around the eyes. Plasma gravidarum is also known as pregnancy mask भी हम इसको कहते हैं. Then pigmented area from xiphisternum to symphysis pubis is called linea nigra. Then pigmentary changes takes place during the pregnancy due to melanocyte stimulation by the anterior pituitary. Okay, anterior pituitary से क्या होता है, melanocyte stimulation होती है जिसकी वजह से pigmentary changes जो है वो देखने को मिलते हैं. The next is a normal healthy woman should gain about 10 to 12 kg of weight during the pregnancy. Water retention at term is 6.5 liter. Due to elevation of diaphragm, because the enlarged uterus, the heart is pushed outward and outward. Cardiac output starts to increase at 5th week of pregnancy. Total iron requirement during pregnancy is estimated approximately 1000 mg of elemental iron. Hormone essential for follicle maturation are FHS, and small proportion of LH, follicle stimulating hormone and luteinizing hormone. HCG, human chorionic gonadotrophin is secreted by the syncytiotrophoblaст cell. जब हमारा फर्टिलाइजेशन प्रोसेस होती है आफ्टर दैट साइटोट्रोफोब्लास्ट सिनसाइटोट्रोफोब्लास्ट होते हैं जिससे हमारा HCG जो है वो सिक्रेट होता है. During pregnancy, preparation of breast is called mammogenesis. Ejection of breast milk is known as galactokinesis. Galactopoiesis refer to maintenance of lactation. Thick yellow secretion from breast occur at 16 week. On examination, height of uterus remain at the level of symphysis pubis पे रहता है. At the 12th week of pregnancy, the level of umbilicus पे आता है. 24 week of pregnancy, then midway between the symphysis pubis and umbilicus at 16th week of pregnancy. Then reproductive period of woman begins at menarche and ends at menopause. The normal period of pregnancy is 280 days, that is about 40 weeks. Discoloration and cyanosis of vulva, vagina and cervix, Chadwick sign, Goodell sign, Hagar signs, uterine enlargement, Braxton Hicks contraction, positive blood pregnancy test are known as the probable signs of pregnancy. The positive sign of pregnancy include the detection of fetal heartbeat, the recognition of fetal movement, and visualization of fetus through the ultrasonography. The positive over-the-counter pregnancy test is considered a probable sign of pregnancy. Over-the-counter pregnancy tests detect the presence of HCG hormone, human chorionic gonadotrophin hormone. Discoloration of the vestibule and anterior wall of vagina is known as Jacquemer sign. ये साइंस जो हैं बहुत ही इंपॉर्टेंट हैं. वन बाय वन अभी तो हम जस्ट डिस्कस कर रहे हैं, बट लेटर जो है in short classes I will explain all the things. Then Chadwick sign, purplish discoloration of vaginal mucosa visible at 8 week of pregnancy. Regular and rhythmic uterine contraction elicited during bimanual examination is known as Palmer sign. The Naegele's formula जो है वो EDD कैलकुलेट करने के लिए यूज किया जाता है. Then perception of first active fetal movement while woman is known as quickening, that is feeling of life, something is there. It occurs about 18 to 20 weeks in primigravida, as early as 16 weeks in multigravida. Okay. Lightning decreased in fundal height a few weeks before onset of labor is known as lightning, that occurs on the 38th week of pregnancy. Lightning is called welcome sign of the baby 38 and the 38th week. Greatest weight gain of fetus occur in the third trimester of the pregnancy. Greatest growth in height length of fetus occurs in the second trimester of pregnancy. Weight जो है वो थर्ड में होता है, लेंथ और हाइट जो है वो सेकंड ट्राइमेस्टर में होती है. Palpation of fetal parts is possible at 20th week of pregnancy. Okay, the last but not least, active fetal movement can be felt by placing the hand over the uterus by 20th week of pregnancy. So all the students keep watching the classes. Lives जो है आते रहेंगे classes, and videos को भी जरूर watch करें. Subscribe the channel and share the channel to the next classes. Thank you. Have a nice day.